Today we're going to talk about infant massage. This is Jen and he will be helping me with my demonstrations. So before you start massaging your baby, you want to set up your space so that you're comfortable. I like to be sitting on the floor because it's comfortable for me, but you can sit on your bed if that's the most comfortable, or sit on your sofa if you prefer. I like to put a towel down so that if I spill any oil, it goes onto the towel. And also if my hands are too oily, I can just wipe them on the towel without disturbing my baby and disturbing the massage process. If you're keeping your baby in their nappy, then you'll need to change their nappy first, because there's nothing worse than trying to massage a baby with a wet nappy. You want to be able to lay them in front of you, in between your legs, preferably if you're sitting. If you're kneeling, you just want them directly in front of you. There are different kinds of oils that you can use for baby massage. I quite like grapeseed oil because it's not too slippery and you can still handle your baby whilst you've got this on your hands. You want to test a small patch of oil on the inside of your baby's elbow. If they have any kind of reaction to it, it should come up quite quickly. It's a good idea to do this in advance just to see how their skin reacts. If your baby is particularly sensitive, you don't want to use any harsh oils. And anything with a fragrance as well, just be mindful that that will stimulate your baby. Now, Jen is ready for his massage. We're going to communicate our intentions first. So Jen, we're going to give you a massage now. Is that okay? Always seek permission from your baby before you massage them. If they're squirming or crying, that means they're not happy with what's about to happen. So just take some time out and restart. So before we start massaging, we're just going to stroke all the way down his body so that he knows we're ready. And this will eventually signal to him that a massage is about to start. When you first start massaging your baby, they might not like it. It might be a little bit uncomfortable for them. So just take it slowly. Just make sure they're nice and relaxed, and then you're ready to go. Now, I'm not going to actually use the oil because I don't want my doll to get oily, but what you want to do is just pour a little bit of oil in your hands and warm it up nicely before you get started. Once your hands are covered nicely in oil and nice and warm, if you start on your baby's face, okay, so you just cup their face and stroke downwards. Now you want to use nice firm but gentle movements. You don't want to be pressing. You don't want to squish your baby's face. And then bring your thumbs and draw a heart on their face. So you start from the middle of their eyebrows, come around and down to their chin. Now it's up to you how many times you do each of these. You can count them or not count them, whatever's comfortable for you. Some people like to have a very specific routine. I don't mind so much, but you just want to get used to these movements. So you've got your heart on the face, and then you come down to their chest. Again, you want to draw a nice heart, so you come up over their chest, down the sides of their rib cage, and to just where their belly button is. This is to just start the blood flowing. First thing that I like to do is what we call milking. We take each arm in sequence. You want to wrap firmly but gently. Don't squeeze the joints. Make sure their joints are nicely supported. Wrap firmly around and stroke all the way down. And if you do the hand over hand, whichever way is comfortable for you, either hand underneath or hand over the top. And you want to come all the way down from their shoulder to their wrist. You don't want to be pulling because you don't want to cause any kind of dislocation or discomfort. And you want to repeat this on both sides. You might want to communicate with your child, tell them what it is that you're doing. It depends on how responsive they are and how comfortable you feel as well communicating with your baby. When you've finished milking their arms, you come down to their chest and you want to use your 2 fingers, okay, and draw this heart shape. You want to be a little bit firmer this time, and then you come to where their belly button is, 2 fingers above their belly button, and you want to go around in a circle. Okay, you can either do this with both hands or just one hand and stabilize your baby with the other. It depends how wriggly they are. And this is really good for digestion. If your baby is struggling with discomfort, this is a really good digestion aid. And then we come and stroke down their sides. So we take both of your hands, so your fingers towards their back and your thumbs over the front, and just stroke again firmly but gently down the sides. And then we move to their legs and we do the same thing that we did with arms. We do the milking, hand over hand, in a way that's comfortable for you. Be careful not to put too much pressure on the joints, and don't pull the limbs because you don't want to cause pain or dislocation. And then you move on to the other leg, same movements, and that is then the end of our quick massage.